chances are pretty good that you know someone who has had problems conceiving a baby, or maybe even you.
Today we've asked Dr. William Dodds with the Fertility Center to come in and talk about a new program they have. Thank you very much for joining us today.
Thank you. Welcome.
So talk about fertility problems. Let's just kind of start off with a baseline and talk about exactly, what's the framework of what we're talking about? Is there a timeline that we're talking about?
Well, traditionally, usually patients are told that if they're not getting pregnant on their own within a year, that's a time when they should probably seek some help and some guidance, some initial evaluation. Recently, though, the American Society of Reproductive Medicine, our kind of parent organization that provides guidelines for us, has revised that and said that if you're over 32, that maybe after 6 months it's reasonable to go in and just get a couple things checked, make sure there's no obvious things that are wrong that should be addressed earlier.
And you say that this all depends on certain situations, especially with age too.
Correct. As one gets older, the fertility rate goes down, and that's a pretty well-known fact. What we find is that fertility pretty much stays normal until age 32 for the young lady, and then at 32 there's a slight drop off, and then from the 35 to 40 there's really a pretty dramatic decrease. After 40, further decrease, so that past 43 it's pretty unusual for someone to conceive on their own.
Okay. And when you talk about the programs that you have, are you finding that women and couples are more proactive and more willing to step forward and say, hey, you know what, we've been trying to have a baby, we really think we need some help, and are coming to you sooner just because of all the media attention? I
think so. I think that there's a lot more education, and that people are taking the knowledge they're getting that's out there in the media and realizing that they can go and seek out answers and get solutions quicker, and I think they don't want to wait as long as they did before. I think some of the stigma of infertility 20, 30 years ago, that's largely gone, I believe. So it's more seen as a disease process that we go to the doctor and try to address.
Okay, so it comes to the time when somebody is going to look to seek help, or a couple is going to look to seek help. They come to you, you have a new program. Tell us about that. Yeah,
we're excited about this new program. As we were saying, there's a lot of stress with fertility, and one of the things that our nurses in particular noticed and that we noticed was that for those patients who have to have a little more aggressive therapy, like a test tube baby procedure, it's an expensive process. It's one that frequently insurances don't cover, and so there was always that, of course I would do this procedure if there was a guarantee that it's going to work. And in medicine we can't give a guarantee. Our success rates are very good, and so we developed a program called Assured IVF. And what that means is that patients can come in and they will pay one fee. We'll do up to 3 in vitro fertilization procedures for them, and they'll either be successful and deliver a baby, or they get 100% refund on their money invested. Which is really pretty amazing.
Why did you decide to go to this? Is it really just a way to let these patients know, we want to be your partner here. Our end goal is your end goal, a happy, healthy baby?
Yes, I mean, that's exactly it. We always felt confident of our success rates, but we could tell someone, yes, you have a good success, and we feel confident about that. But again, I can't say you'll absolutely become pregnant. But the numbers were so high that we felt that we could enter into a partnership, exactly as you said, and essentially the vast majority will be successful. So we feel confident. I think it tells them that we have that level of confidence in their case.
And you mentioned a time frame too, up to 3. But what is that in terms of calendar?
Well, we like them, if they enter into the program, to be able to complete that within 2 years. And we think that's healthy psychologically. We don't want the program going on longer than that. So we don't believe in forever infertility. We believe, make a diagnosis, let's do effective therapy, and get to an answer.
And the technologies are really so incredible, and the sophistication, the level of care. You actually are making it easy for people because you have offices really in different parts of West Michigan. Why don't you tell us how people can get in touch with you?
Well, we have offices. Our main office is in Grand Rapids, and then we have 2 other offices, one in Kalamazoo, just off Stadium Drive there, for those who are familiar with Kalamazoo. And then we also have an office at the Sparrow Professional Building in Lansing.
Fantastic. And of course, your website there, fertilitycentermi.com. Thank you so much for sharing this great information. I mean, I think we all have people in our lives who've been impacted by infertility. And how wonderful to know that there are great solutions that come with a guarantee.
Yeah. Thank you very much. We'll be right back.